Hello everyone, so my name is Andrew, and if you're new to this channel, please subscribe if you'd like to learn more about mental health, psychology, and other related things. So in today's video, we're going to be talking about psychedelics and psychedelic related drugs for the treatment of mental health. So guys, I'm currently a senior psychology and cognitive science major. I plan on going into a PsyD program within the next year after I graduate. So first, we're going to be talking about psilocybin therapy. And this is something some of you may or may not have heard about, and it's an extremely promising research drug that could drastically improve mental health. And by the way, this is actually my presentation for my senior thesis, and this is what this is about. So psilocybin seems to be more incredible. This is in the context of SSRIs. So again, this is pretty preliminary research. We've been using SSRIs for many years, and they are far more reliable than drugs like this that we've been only researching, as you can see, for just a few years realistically. And there's still a lot of research that needs to be done for psilocybin, and just to kind of get a better understanding of how it works, what it does, what should it specifically be used to treat. And yeah, and as you can see, there's been a lot of growing interest here in the last couple years, and this doesn't even show up to 2022, let alone 2023, whenever that happens. So we can probably continue to expect exponential growth here, and this is going to probably become a more mainstream treatment option, whether you believe that this is still a bad drug or not, right? So studies indicate that psilocybin has been approved as a breakthrough therapy by the FDA in 2019, and that it is extremely effective toward major depressive disorder and treatment-resistant depression. So major depressive disorder is a problem, but treatment-resistant depression is like a step further, and it's even a bigger problem because people with this type of depression basically have very little hope for what can help treat their depression. So this is why, especially, that psilocybin can be so effective. Now, this does not mean that psilocybin cannot be used to treat other forms of depression, like less severe or more common depression. But again, we still need to research a little more to understand that a bit better. This psilocybin might also be used to treat substance addiction and terminally ill patients and more, right? So I found research articles on all of these things, on researchers focusing on all of these things. And especially for addiction, not only psilocybin, but also I'm aware of LSD also having a similar effect. Now, LSD is probably a topic for another video. If you guys are interested in that, let me know in the comments down below. However, LSD is something that is not quite been researched, at least to my knowledge yet. It's not been actually FDA approved for research, whereas psilocybin has actually been, as you said here, approved as breakthrough therapy in 2019, and that's why we see this massive spike in interest. So for LSD, that might be more of a future thing. Anyways, psilocybin temporarily increases brain plasticity. Brain plasticity is essentially the brain's ability to more effectively rewire itself and to make different, newer brain connections that might be more advantageous to the person with depression or to the person with mental illness. And especially in many, many studies, what we found is that therapy plus psilocybin drastically decreases symptoms of depression. And so, right, so the combination, not just the psilocybin alone is probably going to be very good for depression from the data that we've seen so far. However, many studies actually combine psilocybin experience with a therapist, with a trained therapist, with someone that knows, they know the drug very well. They know how the experience is going to go. They know how to facilitate the experience, and that's why this seems to be so extremely effective, right? So psilocybin plus therapy and their effectiveness, and that's really what I was just talking about. So the combination of these two is extremely important. There's also other drugs in this slide that I could talk about that also include therapy. So MDMA therapy, right? Ketamine therapy. MDMA therapy especially focuses on therapy, right? Combined with MDMA. It's the same with psilocybin. It's the same with ketamine. However, ketamine is more of an individual experience because of how quick it is, how you focus your consciousness inward. That's how most of these experiences are. You're going to focus your consciousness inward, and you're gonna basically grow, right? That's essentially how this sort of therapy works. And this is an interesting little chart. Increased communication between brain networks. So this is supposed to just kind of suggest that psilocybin creates a vastly higher number of links between brain networks than non-psilocybin users. And of course, this is temporary, but this can be extremely healing for depression, as we said earlier, because the increased brain plasticity. And so you can imagine someone that's depressed, terminally depressed, or chronically depressed, they have these ways of thinking, ways of behaving, patterns of thoughts that are very hard to break out of. So, for especially for like suicidality, it's very easy for someone that's chronically depressed to have these thought loops of like, I'm worthless, blah blah blah. Not that that's a bad thing. That's just kind of how it is, and that's how psilocybin can really break out of those thought patterns. They can make the user see different ways to approach these things mentally, and that can be extremely healing and extremely effective for these people. And that's one of the main reasons why I think psilocybin is very useful. So during psilocybin therapy, first of all, I want to show you guys this graph here. So this is going to show depression severity at baseline. So depression severity ratings over time. So the baseline depression severity is just about 19. 19. So 19 score of 19 is, this is going to be higher relative to all these others. And then 1 week after the session, by the way, the depression scores don't go down after just a week. They go down after a few hours, right? A few hours after ingesting psilocybin, it'll go down significantly. But here we see it drops from 19 to about 7, and then week 2 it drops down to about 6, and then you see it's slowly starting to come back up to maybe 7 again, and then we're going back up to 10. But this is 3 months. So even after 3 months, our depression score has decreased by almost half, which is very, very incredible, very significant, psychologically speaking. And so what this means, as you can see with also the other drugs on this slide, there's a trend. Like it goes down straight away, but then slowly it starts coming back up. And then you can imagine after a year, this person, depending on the severity of the depression of the specific person, depending on how well they actually react to the psilocybin, this might actually go all the way back up to 19, and then they might need to have another experience or another psilocybin therapy session. However, this is a very common trend. This is what you would expect because, again, psilocybin does allow you to change ways of your brain, but it's very easy to also fall back into old patterns of behavior, thoughts, etc., right? So that's kind of how this works. So studies indicate that moderate to large doses are most effective at significantly reducing depressive symptoms. Right here on this graph, you can also read high psilocybin dose. That would be, multiple grams of psilocybin. Again, we're talking about in a clinical setting, not a purely recreational. This is a clinical setting with a trained therapist. Effects are not yet entirely neuroscientifically understood. Again, I mentioned that brain plasticity increases significantly, but we don't fully understand how psilocybin affects the brain neuroscientifically. And I'm not a neuroscientist, nor do I have a whole lot of interest in neuroscience. Sorry for all the neuroscience people out there. But connectedness and acceptance are increased after ingestion. So connectedness and acceptance, basically connectedness is how connected you feel to yourself, to your own mind, to the people around you, to your environment, stuff like that. That's going to go up, and that's obviously going to, well, not obviously maybe, but that's going to increase, that's going to decrease symptoms of depression because you feel more connected. You feel like you're not alone, and that's often what makes people feel quite depressed, as I kind of speak from experience there as well. And acceptance are increased after ingestion. So acceptance is like accepting your state of mind, accepting your depression, accepting your situation in the physical world, accepting the, whatever it might be. And that's also going to, because it's very easy to kind of not accept things in your normal state and kind of push them off, make it maybe, instead of accepting, you're like, wow, this sucks, yada, yada, yada. And that's going to also spike your depression. But whenever you accept things, it's going to seemingly decrease your depression as well. And psilocybin seems to be strongest after 2 to 3 hours of dosing. So this is about the peak of psilocybin. And so basically after this amount of time, this means that the individual is going to have to wait until the drug fully leaves their system in order to leave the therapy, wherever that is. So now we're going to talk about primary limitations of psilocybin. And of course, these need to be talked about. This is a newer drug. It's been researched only for a few years now. But with all the promise that it has and all that I think it really can do for not only the US, but for the world and mental health, there are some limitations we need to talk about. First of all, you can see in the image in the top right, psilocybin status in the US. So you can see it's mostly illegal throughout. However, we have made some progress already. And you can see Washington, Oregon, California, Colorado, here. So there's a lot of states that actually have either decriminalized or just illegal with potential core-based exceptions, but mainly decriminalized, which is I think a very nice step, because if we want this to be a widely accepted treatment, at least in the U.S., we need to decriminalize it throughout. And this is the case, in my opinion, for a lot of drugs, because we shouldn't really punish people for being addicted to drugs that are addictive. It doesn't really make sense. So, like, you're addicted to meth, you're going to go to jail, right? That just doesn't make sense. We should try to help those people. And so, anyways, for psilocybin, this is good progress, because just a few years ago, none of these states were actually decriminalized. And so this is very good progress, mostly on the West Coast, but there's some actually on the East Coast as well. So the biggest limitation that I found in my research by far is small percentage describe their experience as ranking in the top 5 most difficult experiences of their lives. And this is not a stat that you can just, get past very easily. This is only one study that I found that said this, but it does kind of resonate with me. And also the study said that this is in the minority of people that have this experience. But with that being said, top 5 most difficult experiences, those sorts of things would be like the death of a family member, a long-term relationship breakup, or, realizing that you have a chronic illness, something like that. Like, those are not easy experiences, right? And so to think that an experience that's only 2 to 3 hours could also rank in this top 5 or maybe even top 3 is pretty bizarre, right? But with that being said, it is very temporary, and this is kind of what I mentioned during my presentation. It's very temporary. For a lot of you, or for a lot of people that hear this, it might be very hard to get past this thing, this idea that it ranks in the top 5 most difficult experiences of one's life. But I think as we start to learn more about psilocybin and how it works, I think we'll be able to minimize this percentage even more. Probably not, decrease it entirely. It's kind of just like a part of a psychedelic experience, is sometimes, you're going to have a bad mental reaction. However, with that being said, I know this is a limitation to sections, but to give a little more credit to psilocybin, there are really no physical known causes or physical known harms of psilocybin or any other psychedelics. And this is counter to that of alcohol, that of weed. These are drugs that are widely accepted and legal throughout the United States. Alcohol is arguably one of the most harmful drugs socially, to yourself, to your body, right? Not in the world, but that we accept as a society. And this drug is, again, as we see down here, it's a strong negative stigma around psychedelics and their efficacy. So if you ask any random Joe on the street, you're going to be like, most of them are probably going to tell you still that psilocybin is a very bad illegal drug, because it's illegal, and it's not only is it illegal, but it's a Schedule 1 drug. And so this is something that we need to get around. And again, I think decriminalizing more states is going to be very good, but people really need to understand and realize the medicinal potential, what this can actually do for those that really need it. And like I said, this has not yet been legalized for medicinal use. It could be years, could be 5, 10, 15, 20, or even more years, but hopefully within 20 years or less, we'll see some solid, significant improvements, or movement toward that direction of being decriminalized and actually widely available as treatment. So long-term side effects, if any, are not yet known. However, like I said, the physical side effects, as far as we are aware of right now, there are not many at all. The main risk factor for psilocybin and any other psychedelic is that those with predispositions to schizophrenia or family histories of schizophrenia are at higher risk to actually develop schizophrenia or psychosis from that experience. That's also the same with like marijuana. But for most people, most people don't have predispositions to schizophrenia. And most people, I feel like you probably know if you have a disposition to schizophrenia, because you know if someone in your family directly had schizophrenia. So you don't have to worry too much about that. But it is something to consider. Long-term mental side effects are probably more of a concern, like, what does this do to our mind? But as far as physical, there's not a whole lot of evidence on that now. But, long-term, I want to be more aware. So hopefully you guys enjoyed this little section of my presentation. If you guys would like to see more about MDMA, which is also known as ecstasy, or ketamine, let me know. Or SSRIs, that's another section of my on this presentation. Let me know, and I'll make a video out of that. If you like this channel, please like and subscribe. And let me know if you guys have any questions. And see you guys in the next one. Peace.